I'm Dr. Martina and I've been asked to take a focused history on your condition. That is 48/100 and like we are done clicking. I'm going to let you guys in on my score when I'm done. I am so bad. Hey guys, welcome to a new vlog. It is Monday afternoon. I have a class now. We are going to be practicing some physical examinations on patients, some clerking, counseling and things like that. So I have to go for my class. But you guys, I wrote a test and I got 98/200. That is 48/100 and like it is mind-blowing, but let's say I did not pass that test, but I am so happy with my score. When I come back or later, I'm going to gist you guys all about that test I did and why I got such a low score and why I am okay with that score. So I'll see you guys later. This is my outfit for today. Yeah. My ride is here, so I have to start going now. Hey, it is Tuesday morning. Yesterday I was able to do the clerking. I told you guys that we're going to do some clinical practice, so we did clerking. Actually in Nigeria, taking patient history is called clerking, so we did that for like different cases. I practiced my clerking skills and I am so bad, but I have lots of improvement to do. I have lots of things to work on. It's something that with lots of practice you will get better in. But I'm going to talk to you guys more about yesterday and like the details of me learning and practicing history taking and the difference between like how we do it in China and how we do it in Nigeria. It is so different. But that aside, today I actually have a Zoom meeting. I am currently in a Zoom meeting right now and we are discussing clerking in surgery. So how to clerk surgical patients, how to take history from surgical patients, the right way to do it. And we're also learning how to counsel patients. So like we're just counseling a patient that has serious alcohol problems, a man that's lost his job, like lost so many jobs, he's having family problems, he's a very serious alcoholic. So now you as a doctor, you're supposed to counsel this patient, and there's a particular way you're supposed to counsel a patient. You cannot just go and start talking anyhow. So we're just learning that and I'm going to do some practice, and that is all for now. Later I'm going to give you guys more information about, I know I'm already owing you guys 2 gist now about that exam that I got 98/200 and about my whole clerking and practicing my history taking. So I will gist you guys in this vlog, don't worry, soon. This was one of the cases I had to clerk yesterday. A patient that complained about having a mass from his groin. So basically he had inguinal hernia and then we had to clerk the patient. We are done clerking the inguinal hernia, so now we are clerking a patient that has hematuria, so that is blood in the urine. Okay guys, I have been practicing this clerking for a while, so I want to try and clerk this case for you guys, which is hematuria, that is blood in the urine. So you guys will be able to, you know, see how we clerk here in Nigeria, know the differences, and then just for me to practice, because I'm not perfect, I'm still trying to practice. And the case I'm clerking is a surgical case. So clerking in pediatrics is different, clerking in gynecology is different, just so you know. So I'm going to start my clerking. Okay, you guys are going to be my patients, so let us begin. Good morning, sir. Good morning, sir. How are you doing today? I am Dr. Martina and I've been asked to take a focused history on your condition. Sir, please, may I proceed? Okay, thank you. What's your name? How old are you? What do you do for a living? Where do you live? What religion do you practice? What tribe do you belong to? What's your marital status and what's your highest level of education? Okay, thank you very much, sir. Sir, please, what brings you in today? Okay, blood in your urine. Sir, please, when did this condition start? How long have you had this condition? Would you say you noticed the blood at the beginning, midstream, or end of your urination? Sir, please, ever since you've noticed this, would you say the blood has increased or decreased? Sir, please, would you say that it happens more often in the daytime or in the night? Okay, sir, please, have you noticed any pain associated with this condition? Have you noticed any burning sensation? Would you say the number of times that you urinate in a day has increased? Okay, sir, please, do you have any history of pelvic trauma or pelvic surgery? Sir, please, do you have any history of malaria parasite infection? Sir, please, have you been swimming in dirty water of recent? Sir, please, are you currently on any drug, right? Any drug like rifampicin? Okay, sir, please, since this condition started, have you noticed any headaches, dizziness? Sir, please, have you noticed you're coughing up blood? Have you noticed that you feel like you are drowning? Sir, please, have you noticed any pain around your joints or pain on your back? Sir, please, have you noticed sweaty palms, cold sweaty palms? Have you noticed any sudden weight loss? Okay, thank you very much, sir. Sir, please, since this condition, what have you done so far to treat it? Have you been to a herbalist? Have you been to your pastor or imam? Have you taken any concoction for this condition? Have you been to the hospital? Were any tests done on you, like prostate specific antigen tests, urinalysis, digital rectal examination, full blood counts? Okay, have you taken any drugs for this condition, like antibiotics? Okay, thank you very much, sir. Sir, please, are you currently on any drug right now, or do you have any drug allergies? Okay, thank you very much, sir. Sir, please, do you have hypertension, diabetes, sickle cell disease, epilepsy? Do you have any history of blood transfusion, or have you done any surgeries in the past? Sir, for the conditions I mentioned above, do you have any of these in your family? Sir, please, do you drink alcohol? Sir, please, do you smoke? Okay, thank you very much, sir. Sir, please, for this next questions, I would like you to answer yes or no. Sir, please, have you had any sudden headaches or dizziness? Do you feel hot when others are feeling cold and cold when others are feeling hot? Have you noticed any sudden change in your weight? Sir, please, have you noticed any palpitations? You feel like your heart is beating so fast and you can feel it. Have you noticed any swelling around your legs? Sir, please, have you noticed any chest pain or chest tightness or catarrh or cough? Sir, please, have you noticed any nausea or vomiting or constipation? Sir, please, have you noticed burning sensation when you're urinating or any abnormal pain around your back? Okay, sir, please, have you noticed that it's very easy for you to bruise or to get injuries? Have you noticed any bleeding around your nose? Sir, please, have you noticed any pain in your joints when you walk or when you exercise? Okay, thank you very much, sir. Thank you very much, sir. Okay, guys, that is it. This is me practicing, and I feel like the more you practice, the better you're going to get. So, and different conditions are different. I'm not perfect. I am just still learning, and I still have a lot of work to do. So please let me know in the comment section if you're a medical student currently studying abroad. Is this how you clerk? Is this how you take history on patients? If this is not, and you intend to come back to Nigeria, just know that you're going to relearn, and you have to learn and clerk with this method and this process. And yeah, just be mentally prepared for it. And yeah, that's all for now. I'm just going to continue practicing. I'm going to try and collect different cases. For the past few days, there has been like a problem with the electricity. Usually we used to have lights very often, but now, like, most times the electricity is down. So I want to just go out, find somewhere where there is light, and just do some work instead of just staying at home, because like it is hot and just so uncomfortable. Let me show you guys my outfit. Okay, you guys, this is my outfit. Keep my bag. I'm just going to do a little bit of work. I still have like 2 studies today, like a study session to do, like questions, things like that, and another group session. So yeah, and it's like 1 o'clock now. So but everything I need to do needs light, and staying in this house, there's no light, so I need to go and find light. See you guys later. Hey guys, so I just got back. I am so tired, but I achieved some things today. Right now I'm just eating noodles and drinking malt. You guys, of recent I've been drinking a lot of malt. Yeah, that's all for today though. And it was really fun. I'll see you guys tomorrow. Hey guys, so I'm finally here to explain to you guys about the test I did and me scoring 98/200. So you guys know I've been studying for a while, and you know, I took like a mock test to test myself and see, like, you know, progress I've been making. And like, this was the first mock test I was taking. I have done some practice questions before, and I noticed that, you know, there was a lot that I did not know. So when I took this mock test, looking at the questions, you know, I was seeing some questions I had seen before. I saw some things that I understand because I have read them during my study period, and I was noticing a lot of progress that I have made. And that was why, you know, when the score came out and I saw I got 98/200, I was so happy because I have done some practice questions before and I was at level 0, and it felt like I knew nothing. I was trying to answer questions and it's like I could not think, my head was empty. But after, you know, studying for just a little while, I realized that I'm actually making progress. Although my score is very low, but I'm actually making progress. And if I continue to like study harder, I'll continue to make more progress. So I can see the work I'm putting in, and I can also see results. So you guys, I am so happy about that. Today I have another mock test, just like the previous one, but since the last test and this test, I have not done so much studying. I have been doing mostly, you know, practicing for like clerking, counseling, and, you know, physical examination, and I've been doing less like theoretical studying topics and diseases and things like that. But I still want to take this test today and see, maybe, just maybe, there's an improvement, or I must have done better. So I'm going to do that test. It is timed, so we're going to have like 80 MCQ questions and like 20 picture tests. So they're going to show pictures of like different diseases, different cases, and you're supposed to answer questions based on that. So I'll update you guys on my results on that, and let's see how it goes. I'm wearing my medicine shirt. So you guys, a lot of people have been struggling with online classes, and I really understand how difficult it can be. So like, just a while ago I filmed like a short advice video telling you guys what to do if you're finding online classes very difficult, or if you're struggling with online classes, because I can 100% relate. You guys know, during this whole not going to school period, for some months I did my internship online, and I really do understand the struggle. So I made a short IGTV video. I'm going to upload it to my Instagram now, just to advise some of you guys that are struggling and give you some tips that may help you deal with the whole online classes issue. So if you are someone that is in that predicament, finding online classes difficult, go to my Instagram, my IGTV video. That video will be uploaded by then, and hopefully it will help you. So I'll see you guys. Okay, yeah, I'm not seeing you guys yet. I'm about to start the exam I told you guys I want to do, so I'm just exporting the IGTV video now. I'm going to use my laptop so there'll be no distractions, and the exam is going to be for like 45 minutes, so I need to be fast and work. And I'm going to let you guys in on my score when I'm done. So don't have any high expectations, but I'll let you guys in on it. I have 5 minutes left, but I am done answering what I know. So you guys, it is time for me to submit. I feel like I got a lot of questions wrong in this one, but it's a learning experience. So I'm just going to view my score. Oh shit. You guys, wow, I got 55/100. Wow, okay. I got 55 over 100. Last time I got 48 over 100, now 55 over 100. So there's little improvement, especially because I did not study in between the 48 and now the 55. But I still have a lot of work to do. I still have a lot of studying to do. So I'm going to try my best to like do a lot more studying and do more practice tests. So yeah, you guys, it is what it is. I have the opportunity to see the questions I got right, like this one, and then the question I got wrong, and thank God the answers are here. So I'm just going to go through all this and take note of the questions I got wrong, and learn the new answers and study why I got these questions wrong. I want to take a moment to talk about the transition from medical student to doctor. A lot of things are different, and like there's still a lot more studying to do, and especially because I studied in China, coming back to Nigeria, like there are still so many things I need to learn, which I'm just using this period to just learn as much as I can. So everything is good overall. This test I did, this is my second one, and I actually thought I was going to get a much lower score because when I was going through the questions, a lot of things I did not even know, but I just had to answer. But I did slightly better, and I would just say it is good to know that I am improving and not getting worse. So that is just very good. I am noticing that there are some things that I should have done when I was in medical school, and I'm noticing that there are some things that are different, some things that are important as I'm transitioning into being a doctor. So on my Instagram I have decided to start giving some tips and advice, and talking to medical students in China, and just coaching and guiding as much people as I can, so that people will not make the same mistakes I made, and anything that I think is important now that I'm a doctor, I can let medical students know and say, oh, take note of this, you need to know this and do this. So I just want to do that. It's my own way of giving back and just helping as much people as I can, because like we all need to win. And there's this reputation that students that study abroad are unserious students. So any way that I can help you people, anyway I can help medical students abroad, I really want to do that. So I've already posted 2 videos on my Instagram now, on my IGTV. They are just advice videos, and I'll be posting a lot more. So if you're interested in that, please follow me on Instagram, and hopefully with time I'll be able to help as many students as I can. And if you have any questions, any problems as a medical student in China, just feel free to send me a message, and I'll try my best to answer it to the best of my ability. So that is all for now. Thank you so much for watching this video. If you enjoyed this, please give it a thumbs up, leave a comment down below, share this video to anyone that you think will need it, and subscribe to my YouTube channel. Okay, I'll see you guys in my next video. Bye bye.